Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, we're back for the last 15 minutes of the show, and we have Ray back on the phone. Ray?
Yes, you do, Doc. I've got a loaded question for you. If you answer this one, it'll be incredible.
Okay.
Why do women live longer than men? Is there some medical reason for this, or is it just an anomaly, or what is going on here? Why are guys being shortchanged on a few years because they just happen to be guys? You can answer that one more.
Oh, I definitely can. The reason women live longer than men, for the most part, has to do with testosterone versus estrogen. So when you're a male, testosterone is rapidly turning over your fat and your triglycerides and cholesterol. So men basically suffer higher rates of cardiovascular disease than women do, and women do not catch up to men until they go through menopause, and then they're at higher risk for that. So the vessel integrity is better, their overall state of general health is better because of this nasty hormone that makes us who we are. So that's the basic reason. Men probably are also involved in a lot more aggressive behaviors and things of that nature that certainly does help to cause us to be taking a little more risk with our behavior. And I think that also adds into the shorter longevity, which again is testosterone related. I mean, some women don't get involved in the same aggressive behavior that men become involved in. And
does it have to do with the guy being the breadwinner in most cases, and that puts extra pressure on him and takes years off of his life, maybe because he's got to support the family?
Well, yeah, and certainly in today's society, that is a big factor. But some men are love their job, and sometimes they're not very good as far as emotionally involved in their family. So sometimes being involved in work is a very pleasurable thing to them because they are involved in what they can do as opposed to what they can't solve. Women are very touchy-feely. They can sit around, they can talk about things, they can commiserate with each other, they lower their stress level. They don't have to solve problems like men do. We're problem solvers. Ask me a question, I'll tell you how to fix it. And if I can't fix it, it's kind of but women don't have to fix anything. They can just talk about it and feel better. So for the most part, I think that has a lot to do with their personality, and again, that's an estrogen issue. That's a female issue.
And one last question then. Now that you're talking on this subject, do single men live longer than married men because they don't have the responsibility of the family? Is that anything to do with it? And I'll get off of the air to open the lineup, but if you can answer that, I'd appreciate it.
Yeah.
Have a good night, Doc.
Yeah, Ray, and thank you, and have a Merry Christmas and a Happy New Year. Listen, single men, if we're talking about family relationships, and certainly that, I think the married male would tend to live longer if he has a decent relationship in a cohabitating thing where he feels wanted, needed, and cherished. I mean, now we're talking dynamics in the family, and certainly a male who is doesn't involve himself in that particular activity, may also just not be able to handle that and can be free and do whatever he wants to do. And there might be some trade-offs in there. I don't know what the actuarial tables really say with regards to that, and I don't know that anybody has really defined it. And certainly it's very stressful if you look at what we call the life stress things, what makes a life very stressful, or what are events that take place in a lifetime. Loss of a loved one is the #1 stressor for people. And secondary to that is a move, meaning you have to move to a different location, moving your body, moving your household. Those can be the stresses, and I think they go down obviously from there. So, and certainly, if you were married in a good relationship and you lost a spouse, then that would be a very big issue. So, and obviously, if you're a single male, never been married, then you wouldn't have that issue. But you might have trade-offs in other areas. So it's a very difficult thing. But I know estrogen and testosterone really does play a big role. And that book, Men Are From Mars and Women Are From Venus, really is a very good explanation of the difference between men and women, and why women do a lot of the things that they do and why men do a lot of the things we do. And it's really important to understand that. The other book that is very excellent for relationships, and I'm going to digress for just a second, is called The 5 Languages of Love. The 5 Languages of Love. These are easy books to get, but it talks about what we do. Men know how to communicate on one level, women know how to communicate on another, and probably a lot of times they digress, men and women digress, because they don't really know how to communicate well to each other. So I am no expert in relationships, trust me on that one, but at the same time, I've listened to a lot of those things and have dwelled into those books, and they do make a lot of sense, and they are very, very helpful. And if you happen to have a relationship issue going on, you might want to take the time to spend a little time reading and understanding the opposite sex, if that's your relationship. If you are involved in a homosexual relationship, well, then you have different issues that you have to deal with, and usually you understand the same sex a little bit better than the opposite sex understands that. So, but anyway, again, testosterone plays a big role in why males expire earlier. And certainly if you have a risk behavior such as alcohol or you are a smoker, it will accelerate that. Take that for what it is. So as we get again ready to wind down for the year, it's certainly been enjoyable to be on the show. I appreciate the callers and the positive feedback, and I want to thank my good friend Jerry D for helping me to support the show. He is an excellent person, and I really appreciate his generosity. Mark?
One more time.
Mark, are you on the phone? Mark. Hello?
Hello?
Mark.
Yeah.
Okay, well, you're on the line.
Oh, hey, I got a question to ask you.
Yeah.
When I have a bowel movement, okay,
Yep.
every time I have, within the last 2 weeks, every time I have a bowel movement, I have like a white, milky substance coming out of my bowels at the same time. Could
Yeah.
you possibly tell me what that is?
Could you what now?
Huh?
You have a discharge from your bowels?
Yeah. It's
Okay.
a white, milky substance.
Do you have any pain?
No.
Okay. And this is a new occurrence? You've never had this before?
It happens every time I have a bowel movement.
Okay. Every time for your entire life or just in the past 2 weeks?
Say that again?
Every time in your life or just in the past 2 weeks?
No, within the past month.
Okay, within the last 6 months?
Oh yeah,
Okay.
within 2 weeks.
Okay, has your diet changed?
Huh?
Has your diet changed?
No,
Okay. And
but I do have diabetes,
okay.
and I do have high blood pressure.
Okay. And has the caliber of the stool changed? Has it turned from white to...
Well, I constantly have diarrhea.
Ah. Well, then you may have colitis, okay? And that
Huh?
white substance you're talking about may be pus or some other abnormal discharge coming from the bowels. And that you need to get in and get a colonoscopy or get some type of examination to make sure that you
Well,
don't...
I had a colonoscopy about 4 years ago.
Well, that doesn't matter. Your symptoms just started within the last 3 weeks or a month or 2 weeks, right?
Yeah.
Okay,
Yeah,
so
right.
so things can change, and the fact that your bowel movements have changed, and the fact that you have some
Wait. Can you talk a little bit louder?
What's that?
Can you talk a little louder?
Well, what I'm trying to say is that your bowels have changed in the last 2-3 weeks or whatever,
Right.
and
Right.
and 4 years ago doesn't matter anymore. You need to get in and get that checked out ASAP as soon as possible.
Now, do you know what it could possibly be?
Well, like I said, I thought it might be a colitis based on what you're telling me.
Wait.
A
Say
bowel,
that again.
a bowel infection
A bowel infection?
or a bowel irritation, yes.
Oh, okay. Yeah, it almost it almost looks like sperm.
What?
I said it almost looks like sperm.
Well, now that I
But
can't...
but I have a lot that comes out.
Well, and like I said, I don't know that that's the case, but you do need to get into the physician or your doctor of choice to have a bowel sample sent off to the lab and check that out, okay?
Oh, okay.
Thank you for calling in, Mark. Okay, so hopefully Mark will go out and get an attention for that particular issue so that whatever it is can be solved. Well, we just have a couple of minutes left, and again, I want to thank you very much for tuning into the show, and I will be back after the first of the year so that we can continue on with topics, and then certainly if you have any topics or questions or anything like that, you can feel free to call those in, and we will see if I can discuss those. One of the things I'd like to discuss next year would be more in the way of maybe, I was trying to get a few other people on the phone. I'm hoping the Grove will get their dispensary open so we can talk with them. And if you're looking to get that medical marijuana card, you might want to do that quickly, because I understand when the Grove does open, you will not be able to grow within a 35-mile radius. So that's one other thing. So anyway, have a very, very safe Christmas and a Happy New Year, and I'll see you back next year. Thank you.